Hi, it's Dr. Gruss. I'm here in the anatomy lab to talk to you about differences between the bony pelvis of a male and a female. So obviously there are a lot of differences in the pelvic region between men and women, and those have to do with reproduction. When we look at the bony pelvis, we are looking at differences that result from the requirement of the female pelvis to be able to give birth to an infant. And of course, the largest part of the infant when it's born, the largest bony part that has to pass through the pelvis is the skull. So this here is a plastic model of a skull of a newborn or a neonate. And this is life size, so that's about how big a baby's head, a baby's skull is going to be when it has to pass through the pelvis. So we can see a number of places where the female pelvis is different from the males that basically enlarge the passageway that that baby has to go through in order to get out of the mother's body. So the birth canal begins with a place called the pelvic inlet, and that's this ring that you can see here up at the top of the true pelvis. The true pelvis is this cavity down here between the pubic bones and the ischium and the sacrum. This area up here is called the false pelvis, and that's actually part of the abdominal cavity in life. So we've got this, what we call the pelvic inlet, and it's called that because that's where the baby's head, which has been sitting up here in the uterus in the later stages of pregnancy, that's where the head has to enter the birth canal. So it has to start passing through the pelvis on its way out. And that pelvic inlet is marked by this sacral promontory right here, the part where the sacrum sticks out at the top and the front. This sort of line right here is called the arcuate line. And then up here we have the superior pubic rami and the pubic symphysis. So these structures mark the pelvic inlet. After passing through the bony pelvis here, the baby has to go through the pelvic outlet on its way out. The pelvic outlet is, just for a moment, the pelvic outlet is here, and it is demarcated by this distal sacrum and the coccyx right here. The ischial tuberosities right here on the ischial bones, and the ischial spines, which are these little pointy parts that stick, that project sort of backwards. Turn this the right way so that you can see where those ischial spines are. Right here and here. So those sort of project in, and all of those things have the potential for blocking the baby's head from passing through the pelvis and getting out. Now, just before I start talking about differences between the male and female pelvises, let me point out to you some important differences in the skull between an infant and an adult that also help make it possible for that baby to get through there. So it's not all having to do with the mother's anatomy, it also has to do with the infant's anatomy. So this is an adult skull, and you probably remember that these joints between the bones of the skull are called sutures. So that's a particular type of immobile joint in an adult. And you'll see that in the adult skull, those bones have finger-like projections that interlock with each other like a jigsaw puzzle, like this. And so those interlocking projections of the sutures make the sutures an immobile joint. We don't want our parietal bones to be able to move relative to each other, and the shape of the sutures prevents that from happening and protects the brain. However, if you look at a neonate's skull or a fetal skull, you will see that the sutures don't look like that at all. They are basically a straight line. So here's the baby's face. First of all, there's a suture running down the middle of the frontal bone that will disappear most of the time as the baby gets older. But here's the sagittal suture and the squamosal suture, okay, coronal suture. So all these sutures that you recognize look a lot different in a neonate. The edges of the bones are smooth and they just sit right next to each other. We've also got these soft spots or fontanelles in the baby's head. Now there are a couple of reasons for this. The first one is if the baby sutures were all interlocking like this, the baby's skull would not be able to grow because the growth of the skull bones happens along the edges. And so if those skull bones were already locked together, the baby's brain wouldn't have anywhere to expand into as that brain grew. So those bones don't start locking together until brain growth is done. But the other reason is that this makes the baby's head actually quite malleable, and it's perfectly normal as the baby's skull is passing through the mother's birth canal for the skull bones to actually bend a little bit and move a little bit relative to each other and even overlap each other a little bit. And this formation of the baby's head makes it easier for the baby to pass through the birth canal. All right, so that's an important factor in fitting that head through that birth canal. But now let's talk about some differences between the male and the female pelvis in an adult, and you should be able to see how the female pelvis is uniquely structured to allow baby's big head to pass through. Not that that makes it easier, but it makes it possible in most cases. And I should maybe also say that not in every case. There's also something called cephalopelvic disproportion, cephalo meaning head, and that's when the baby's head is just too large to pass through the mother's pelvis, in which case vaginal birth cannot happen. Okay, so first of all, just overall shape. The female pelvis is wider proportionally than the male pelvis, and it's also shorter. So it's generally shorter and wider, and you can see that if you just sort of compare the overall shape. This is the female pelvis right here, and this is the male pelvis right here. So the female pelvis is overall shorter and wider. The ilia tend to flare out more in the female pelvis than in the male pelvis. Okay. If we look at the pelvic inlet, you'll see that in a female pelvis, the pelvic inlet is sort of a wide oval. In the pelvic inlet in a male pelvis tends to be narrower and have more of a heart shape. It's a little bit hard to see both of these at the same time in this view. That gives you a little bit of a better view. So that pelvic inlet is wider and more oval shaped in a female and narrower and more heart shaped in a male. Many of the features that widen the female pelvic or birth canal and make it easier for the baby to get through have to do with the pelvic outlet. So remember that I said that the pelvic outlet is bounded by these ischial spines and the sacrum and the coccyx, the ischial tuberosities, which are right here. So we have a few. A lot of the differences between the male and female pelvis, the things that allow the female pelvis to allow the pelvic birth canal to widen have to do with the pelvic outlet. So again, the pelvic outlet is bounded here by the ischial tuberosities, the sacrum and coccyx, and at the back, the ischial spines, which are here and here. So a lot of the things that make the female pelvis different from the male pelvis have to do with sort of pulling all those structures apart and widening that pelvic outlet. So let's look at the male pelvis first. Pelvic outlet. You can see those ischial spines pointing inward right here. You can see that sacrum and coccyx curving forward and pointing towards the middle of that, what would be the pelvic outlet, and then the ischial tuberosities are sort of pulled in as well. In the female pelvis, the ischial spines are farther apart. Just got around here. The ischial spines are farther apart, and the coccyx is farther back, and the ischial tuberosities are also farther apart. So how does this happen? Well, there are some features that we can easily see that make these differences between the male and the female pelvis. First of all, the easiest one that I always think, the easiest easiest way to identify a male and a female pelvis is to look at what's called the subpubic angle. And this is the angle between the two pubic bones on the bottom, the inferior pubic ramen. In a female pelvis, that's about the angle between the index finger and the thumb, so about like that. Whereas in the male pelvis, get this back in focus here, in the male pelvis, that's much closer to the distance between, or the angle between the first and second fingers. So that subpubic angle is very, very different in a female pelvis versus a male pelvis, much, much wider in the female pelvis, and that makes a lot more room for that baby's head to push through like that. So that widens the front of the pelvic outlet. As for the back of the pelvic outlet, there are a couple of things that happen. This angle right here, between the ilium up here and the ischium down here, is called the greater sciatic notch. So this place right here. So that here's the greater, the ischial tuberosity, ischial spine, and there's the sacrum. So that's called the greater sciatic notch. If you put your thumb in a male greater sciatic notch, it usually fits pretty tightly in there, so it's about the width of your thumb. If you look at the female greater sciatic notch, it's much, much wider. So my thumb has room to move back and forth in there. So what that has done by widening that greater sciatic notch is to pull the sacrum backwards and pull the ischial spine sort of off to the side. So that helps widen the back of that pelvic outlet. Finally, one other feature that's easy to see is the shape of the sacrum and the coccyx in a male versus a female. So this is a female sacrum and coccyx seen from the side. So here's the sacrum and here's the coccyx down here. And you can see that the sacrum has a gentle curve, but a sort of a flattened curve in the female. In the male, the sacrum has a much sharper curve. So it curves sharply forward, bends sharply forward. Now this is great for holding up the pelvic floor, so helping hold our organs in down here, our pelvic organs like our bladder and our rectum and other, the other organs are different between males and females. But this curvature of the sacrum and the coccyx helps give a lot of support to the pelvic floor. But you could never fit a baby's head in front of that sacrum and coccyx. In the female, by flattening out the sacrum and the coccyx, you have essentially pulled them backwards and made a much larger space in here. So that really helps with childbirth. It does cause women some problems. Actually, I should first say that it still does happen that the baby's head sometimes breaks the coccyx on its way through. So that's unpleasant. The other problem that we have is that we don't have as much support down here at the bottom on the pelvic floor. So that, combined with the stresses that are put on the pelvis during pregnancy and childbirth, mean that women sometimes have problems with support of their pelvic organs, and they can have something called pelvic organ prolapse, where some of those organs actually start to sag down through the pelvic floor. So easiest ways to tell male from the female pelvis are sort of overall size and shape, with the woman's pelvis being wider and shorter, that subpubic angle, which is much wider in a female than in a male, and then that greater sciatic notch right here, which is also much wider in a female than in a male, and the sharp curvature of the sacrum and coccyx in the male pelvis versus the flatter one in the female pelvis. All right, so I hope that helps you figure out what kind of a pelvis you're looking at. And if you have any questions, feel free to get in touch with me or with your instructor.